Ontario's healthcare system is undergoing change. It is meant to improve access to those in need and effectively coordinate healthcare in a patient-centered system. Municipal governments contribute over $2.1 billion of property taxes to the province's healthcare system, and that's noticeable assistance. This funding is not just about public health and paramedic services. It's also about long-term care, doctor recruitment and retention, medical and hospital capital construction, as well as integration with other frontline services that promote healthy living. Our interest is basic: caring for those living in our communities and improving the quality of life. I know that we share this in common with the province, and I'm pleased to welcome the Honourable Christine Elliott, Minister of Health and Deputy Premier. She was elected in the riding of Newmarket-Aurora in the June 2018 general election. She is not new to the provincial legislature, having served from 2006 to 2015, representing the riding of Whitby-Ajax and then Whitby-Oshawa. In 2015, she was named the Patient's Ombudsman until she decided to rejoin the political world. I know the Minister will have your full attention as she explains the province's vision and then update us on public health, EMS, and dispatch. So please welcome the Minister of Health and Deputy Premier, the Honourable Christine Elliott.
Well, good morning, everyone. It is a great pleasure to be back in Ottawa this week. I've already had the opportunity to stop and chat with many familiar, friendly faces, and I look forward to doing so even more over the next few days. But as Ontario's Minister of Health, I should be, and I am driven by a relentless commitment to strengthen our public healthcare system. Because the people of Ontario deserve the peace of mind that the system is going to be there for them when they need it, now and into the future. Indeed, access to publicly funded healthcare is fundamental to our shared understanding of what it means to be an Ontarian and a Canadian. But factors are threatening the long-term sustainability of our system, not the least of which includes an increasingly aging population with complex care needs. Simply put, the future of our healthcare system that we cherish and respect is at risk. We must make changes to ensure that we have a strong, fully accessible system for our children and our grandchildren. As Minister of Health, I do take that responsibility very seriously. Our system is in need of transformational change, and that's why I am proud to report that our government is delivering this change with our plan to build a modern, connected, and sustainable public healthcare system. Over the past year, we have made great progress on our promise to build a connected, integrated, coordinated system of care, one that is truly centered around the patient and the patient's needs. With the creation of Ontario Health, the province's new central health agency, and the work that's been accomplished towards the establishment of the first wave of local Ontario health teams in our communities, we have made great strides together in delivering on that promise. And I do want to emphasize that these teams will be based in and driven by local communities. That is the only way that we can deliver truly patient-centered care. So as part of this plan, we also need to consider how best to deliver public health, a central component of community health care, in a way that is resilient, efficient, nimble, and modern, in a way that meets the evolving health needs of Ontario's families. Within the context of this broader and desperately needed health transformation, we have an opportunity to modernize and strengthen the role of public health and to consider how it is connected to our communities. As you know, several months ago, our government announced our plans to update the way that public health is structured in Ontario. And, as you also know, our proposed approach inspired widespread, and I would say spirited, discussion. So I want to be clear, we are a government that listens. In fact, my ministry has been working diligently with AMO, the City of Toronto, and with the Association of Local Public Health Agencies. That's been at technical tables since April to discuss this important work. We heard about the need for more time, not only to accommodate changes to cost-sharing arrangements, but also to ensure a seamless transition to new regional entities. And we also heard about the need to consult more broadly. That's why Premier Ford made a clear commitment to pause any changes to the funding models for 2019. We are maintaining the status quo for this year. Doing so will offer municipalities the time you need to find ways to support our shared objective of a more sustainable public health system. Our goal is to offer municipalities increased stability as we begin to transition to updated funding models. So I want to provide clarity on where we are headed with respect to these updated models. I want to start by assuring everyone here today that future changes will build in protections for municipal budgets, all municipal budgets, and that budgets will be treated the same. Starting January 1st, 2020, all municipalities will transition to a 70-30 cost-sharing funding model, 70 province, 30 municipality. In the first year, no public health unit will experience an increase over 10% of current public health costs as a result of this cost-sharing change. That's the protection we have built in to ease with respect to this transition. We do recognize that there are municipalities that already contribute 30% or more. These municipalities won't experience any impact. Now, our government remains as committed as ever to strengthening public health care in Ontario. So while the way we are implementing our plan to strengthen public health care has changed, one thing has not: the need to do so. Though the sector is filled with dedicated and experienced professionals who are fully committed to serving the people of Ontario, there continues to be a clear need to modernize and update our public health sector. In 2017, the Auditor General reported that public health units are not well coordinated and are duplicating work, and that since 2014, about 1/3 of public health units have undertaken research on a number of common topics. This includes research on topics such as sugar-sweetened beverages, energy drinks, e-cigarettes, and alcohol. We don't question the need for research on these important public health topics, but we do question the need to invest taxpayer dollars to produce multiple reports on the same issue. The Auditor General also reported that public health services are delivered inconsistently across the province. That is not fair or equitable to the people of Ontario. People need to know that the services offered by their public health unit are available to them no matter where they live in the province. Finally, absent size and scope, some of our public health units struggle to recruit and retain the healthcare professionals they need to deliver high-quality services. Something needs to be done. The status quo just is not an option. And it's important that we do this right. That's why our government will soon launch renewed consultation with municipalities and our partners in public health. This will be in addition to the work that is already now being done at the technical tables. Through this consultation process, we will ensure that sufficient time is provided for thoughtful dialogue and implementation planning. I am also pleased to announce today that this next phase of engagement will be supported by an expert advisor who is dedicated to this work and who is knowledgeable with respect to municipal issues. Over the next few weeks, we will work with this advisor, with input from AMO, of course, to begin this consultation, which we expect to launch early this fall. This next phase of engagement will be defined by openness and transparency, anchored by the release of a discussion paper. Among other aspects of the new regional entities, this paper will outline our proposal for boundaries for the new regional public health entities. These proposals are intended to help guide these consultations. They should in no way be considered final or inflexible. I also want to take a moment to share with you that the advisor will also support consultations on emergency health services. We heard your concerns about the proposed changes to land ambulance. We responded to those concerns by announcing that in-year cost sharing for those services will be maintained. And I am here to tell you today that Ontario will not be reducing funding to land ambulance services. In fact, municipalities will receive nearly 4% more in funding for the 2019 calendar year and can expect continued growth for 2020. The funding letters are going to be sent out imminently. We will continue to work with you to ensure that the modernization of programs and services is informed by your advice and by your community's daily realities. This means prioritizing dispatch technology modernization and the piloting of new patient care models for select 911 patients, while slowing down and consulting on how the integration of communication centers and emergency health services can be done more effectively. Our government is building a healthcare system for the people of Ontario. We are building a modern, sustainable, and integrated healthcare system that starts and ends with the patient. Modernizing our public health sector and our emergency health services are important and an important part of our plan. Because the important work we are doing today, Ontarians can rest assured that there will be a sustainable healthcare system for them when and where they need it, now and into the future. So thank you very much, and I'd be happy to take any questions you may have. Thank you.
Thank you very much, Deputy Premier Lynn Dolan, Mayor of the Town of Innisfil, and past President of AMO. My question is in regard to land ambulance. When paramedic services were transferred from the province, they were in very poor shape, and municipal governments have invested significantly. So, and we do appreciate the comments today about the increased funding for land ambulance and also the badly needed modernization of the dispatch service. However, our frontline paramedics believe that modernization means privatization. Is it the intention to privatize land ambulance?
No, absolutely it is not the intention to privatize land ambulance. Absolutely not. We want to strengthen our public health care system, And what I've heard with respect to several of my colleagues who are very appreciative of the services that paramedics are providing in addition to the emergency health services, they said as you're providing this new system and integrating healthcare, don't do anything with respect to what the paramedics are doing in the land ambulance service, because it is a way of making sure that we can integrate care for patients, provide them with the services they need, hopefully prevent them from needing to go to hospital more often, to be able to tend to their healthcare needs at home, which is where they want to be. So we consider that to be a very important service, and we value your input and consultation on that issue. Thank you.
Good morning, Minister, and thank you. My name is Joanne Albert. I'm the Mayor of the Municipality of Tweed and the Chair of the Hastings Prince Edward Public Health Agency. My question is, the 70-30, we will receive transitional funding in 2020.
Yes.
Yes, okay. Now, I would just like to know, rather than, instead of revamping or changing the entire public health system in the hope that it solves some long-standing issues in some places, why can't we slow this down and have a conversation about alternative solutions? I think I heard that this morning. With the appointment of this advisor, does this mean that the dates that we have heard are no longer?
No.
By April of 2020, I thought the new health areas, boundaries would be in place.
Well, we are still implementing the change as of January 1st, but there will be that help for any municipalities whose public health budgets will increase by more than 10%, because we know that this is a difficulty for municipalities in many cases. But we also want to make sure that we start these consultations as soon as possible, and we know that we need to be listening to all of you as municipalities, to AMO, to understand the work that needs to be done in order for this to be done in the proper way, to make sure that the boundaries that are created are appropriate for municipalities. I know there's been a lot of concern about that. We want to sit down and talk to you about what is going to make sense, and to understand about what should be local public health concerns, what should be more provincial health concerns. So the low-income seniors dental program, for example, that we brought forward several months ago, is something that we believe should be a provincial responsibility. There are other areas that may be more appropriately provincial, but you will have local issues that we want you to be able to concentrate more of your time and efforts on, because that is something that you know about far better than we do. Thank you.
Time for one more.
Okay. I'm told one more question. Yes, thank you.
Over here. Ms. Elliott, to your left.
Oh, I'm sorry.
Thank you.
All
No,
right. Thank
do
you,
not
and then we can
apologize. It's a big room. Thank you very much. I'm Michael Donoghue. I'm the Mayor of Admaston Bromley Township in the Ottawa Valley, and also Chair of the Health Committee for the County of Renfrew. So we have oversight of public health, the paramedic service, and long-term care. With respect to public health specifically, I have not heard clarity. The move to the amending the cost sharing formula, is that only applicable to the current 75-25, or is that applicable also to the 100% provincially funded programs?
That is something that's applicable to the ratios that currently exist. So there were different ratios that you probably heard that were going to be applied, including the City of Toronto. And so it's what we heard from many municipalities was the 70-30 was more appropriate, but for those municipalities and for those public health units, they're already paying that amount, there won't be an impact. But we do recognize for some there will be an increase that will need to be paid, and that's why we're offering the transitional funding to assist in any situations where the public health funding increases by more than 10% overall. May I, just one more?
Okay.
Yes. Yes,
We
thank
could
you.
have a mic just over there, just one moment.
Sorry, I said yes before. I don't want to leave you out, so thank you.
I have a bit of a twofold question. One, I understand that you're going to make it so that the budget doesn't increase by more than 10%. But when we're talking about money, we can't pass that on to our constituents. I mean, in our Northern Ontario, some of our areas are very small, and we have less than 2,000 people that are paying taxes in our small area, and that is a hit. We pay the same taxes as the people in Muskoka. My next question, or part of it, that is, I guess, where I started off, is, so in Northern Ontario, for anyone to get health care, we have to go far distances.
Yes.
Downtown Toronto, you have a hospital on every other corner, which thank God you have, because we also use those services. I live in a little town called Burkes Falls, or just outside of Burkes Falls. My closest hospital is Huntsville, so it's about a 40-minute drive. A lot of our people have to drive over an hour to get to a hospital. There is nothing in between. There's no sort of satellite offices or anything. And Northern Ontario, farther north, has even less than we have. What does the minister promise to do or have plans to do for Northern Ontario residents that are cut off from medical services?
Okay. Well, thank you for both of your questions. First, with respect to the funding issue, that is why there is some transitional funding that is being offered. If there are more significant difficulties, of course, that's something that will come out in the consultations. That's why we need to have that discussion in addition to what's happening at the technical tables. So that's something that we need to hear about. Secondly, with respect to Northern Ontario, I am becoming more educated in the needs of Northern Ontario, and I understand that distances are very significant, sometimes to the point that people don't receive the health care that they need because the distance is so fast and they can't receive the grants in time. That is a big concern to me because everyone in Ontario deserves excellent quality health care. That is part of the work that we're doing to create a more integrated healthcare system. What we really want to do is, because we know every day over 1,000 people a day are receiving hallway health care in hospital hallways and meeting rooms and so on, we want to offer more local care for people so that they don't end up in hospitals, so that we can prevent the need for some of that travel. It won't eliminate it, I know that, but we want to build up the community resources so that people can receive care closer to home. And we also need to use technology more. We can do things like setting up virtual visits. That won't be appropriate for everyone, but it will be for certain kinds of issues. So we need to use that, integrate the care, connect to the care, use the technology, make sure that people can receive the care at home. One big area that I'm working on right now that I've heard from several of the municipalities is with respect to a sharp increase in mental health and addictions concerns, and addictions, in particular opioid addictions, but mental health concerns as well. And people end up in crisis in hospital because they simply don't know where else to go. That's their default position. If they are in crisis, if they're having suicidal thoughts, they go to the hospital. Often they can't get the care they need there either, or they end up in the hallway. We need to build up those resources in the community to make sure that people, if they're experiencing that crisis, they know where to go in the community and they don't end up in hospital, because often they don't get connected with a mental health system, which we're actually trying to build right now. We don't have much of a mental health system. That's why we have brought forward the concept of the Mental Health and Addiction Center of Excellence to be able to be the agency that helps connect those services. We will be debating that this fall, and I hope it passes, but I think that's the foundation work to make sure that we build a strong system for people across the entire province, especially including Northern Ontario, because I know the supports are even more scarce in Northern Ontario. So thank you very much, everyone. I really appreciate your time and attention. It's great to be here with you all today. Enjoy the rest of the conference. Thank you.
Thank you very much, Minister Elliott, for outlining your program and for, more importantly, committing to consultation. Now that ends the morning session. Caucuses, lunches are taking place across at the hotel. Thank you.
I don't understand a word you say. I'm so confused, yes. Leave me confused.